rather not get pregnant than get a child. You see, like, hey, but I mean, spatable. Hata sitaki kufikiria, no. So, kwa mzidigide anasema akona ka pimple. Nimepaka mafuta lakini bado mchungu haishi.
Yes, sir. You already know what it is. This is the Uninterrupted Podcast. Kama kawaida. This is Tito himself, and you already know we're killing it today. And today is a new venue, is a new place. We're doing it new style, new places, and new everything. Today I have a very amazing guest. I would like him to introduce himself and tell us what he does. Yes.
Thank you, Tito, for the welcome. My name is Kibiwot Cheriot Augustine. I'm a registered clinician working with the Curafa Clinic, Eldoret.
Mm-hmm. Yeah. Also, what do you specialize in?
General outpatient, mostly kids.
Mostly kids. Oh, so we can technically say you are a pediatrician.
Outpatient. Yeah.
Pediatrician.
General practitioner.
General practitioner. Oh, yes. Okay. So, we practice for how long?
It's been 5 years.
5 years of practicing. Yes. Nice. So far, how's the experience as a medic?
It's good. A bit of challenges here and there, but we're good.
Lots of challenges. Yeah. How is it? Are you among the guys who were strike, or you guys were still working?
No, we're in the private sector, so we didn't go for strike. But the guys who are county employed, they're the ones that went for strike. Oh,
so wagava wakienda strike, nyie hamwendi strike?
Yeah, wendi sit ko job, but tunawa support.
Mnawa support.
Yeah, but ko job.
Okay. Hard question. Sawa.
Yes.
So let's say Gava wakienda strike. So guys in government wakienda strike. Do you guys feel the pressure of the workload yenye hawa sio wameacha, or everything is just normal, or how does it go about?
The workload is there. You see, if the guys in the government go for strike, you see services come diabetic clinic, CCC, where they see TB patients and HIV patients. Mm-hmm. They operate, but not like normal. Mm-hmm. So there's that gap. Also outpatient. Mm-hmm. The big number that of patients that are seen in the outpatient, when I end up kwenda kwa private facilities, of which they cannot afford the services, so you will encounter most of the people buying drugs over the counter. So that's the big problem. So anyway, we cover the deficits and we move on. But you can really feel the impact of the guys on strike.
Yeah. So comparing, have you ever worked in the public sector before?
Just once when I was an intern. Yes.
Ulikuwa intern wapi?
It was at level 5, around level 6. Level 5 hospital, yeah.
Embu level 5.
Yes.
Comparing private sector na public sector. How's the difference ya job?
Public sector is good because the public sector is good because you have the facilities, You have the equipment, you have the meds, you have everything, and you have like you're a manager of your own. And then you're able to work and provide the best quality since everything is available. Whilst in the in the public sector, there's a bit of challenges here and there, but it's okay. A lot of mentorship in public sector, a lot of experiences, and you get to learn a lot. That's what I can say. But again, you see, with the healthcare structure, we still lack some basic things. But when you go to the private sector, everything is there for you.
Okay.
So whatever you learned in the public sector, you just apply here, and everything moves smooth.
So umeguzia something considering expense.
Yes.
So you said some people would like to come to the private facility, but expense cost.
Yes.
The cost is a bit high.
It's a bit high, yeah.
So majority of the group that is affected, would you maybe identify ama?
Yes, we can identify. Like for me, I work in an outpatient setup, which is a level 2, which we target the low income people, the low income community, people from that community, and we see people from the state, from the estates, slums, and people around town who cannot afford expensive private healthcare.
Okay.
So I can say the people that we see are the middle and the lower class, especially the lower class.
Okay.
Yes.
Okay. So from these guys that you see, what are the most common problems that unakutana nazo?
Number one, I can say non-communicable diseases, like diabetes and hypertension. That's the common problem I see. And then there are these, we can see antenatal mothers that come from clinics, ultrasound services, and also infectious diseases. Say bacterial infection in children under 5. Those are the common. Then the normal diarrhea, flu, upper respiratory tract infections. Those are the ones we see. But the number one are the non-communicable diseases. That is diabetes and hypertension. Yes.
Do you guys get support from the government? Or you guys are completely independent from how you operate?
We are completely independent, but ours is a franchise of hospitals.
Okay.
Let's say the Curafa is sponsored by Accessafia. It's a branch of Accessafia. So there are programs that come and go. We have programs for the diabetic people and the hypertensive people. We also have a program for the children under 5s and expectant mothers.
Yeah.
That is supported by Accessafia, but the government only provides us with the logarithms and the referral structure.
Okay. I'll ask you a very hard question for now.
Okay.
Another hard one. Yeah.
So let's go.
I don't know how well you're informed about this, but maybe if I may ask about the SHA program, how is it working with you guys?
I could say it's quite difficult for us and most of the level 2 and level 3 and level 4 hospitals. They only take SHA for inpatient, but outpatient, they don't take SHA patients. And most of the private hospitals have not adopted the SHA SHA medical cover because of the capitation, you see.
Yes,
the government really lowered the amount of money that one can spend in one visit. So most private hospitals tend to shy off from that.
So we can say the provision that they give for outpatient is quite lower than what you guys can accommodate.
Yes. And see, we can say let's charge even a consultation fee of 300 bob. The government gives you 500 or 300 bob to treat an illness like malaria. You have to have labs there. You have to have consultation. You have to have meds. So you see, 300 bob won't cover that.
Yeah, it
so
can't.
I'd rather not see SHA patients. See?
Okay.
Yeah.
So for now, you guys are not seeing SHA patients.
We are not seeing them.
Okay. And has this really affected how you guys used to operate with the other NHIF, or what's the difference that this SHA has brought?
There's a gap. You can feel the gap. You see, for inpatient services, the private hospital are really taking in. There's no problem with that, but the number has really gone down from the previous NHIF.
Okay. That's quite significant, because I think today I just found out that private hospital, what is it called? The Association of Private Hospitals has suspended the use of SHA in their facilities. Yeah, I'm sure this is going to take a toll on very many people.
Yeah, on the patients.
So okay, I wanted us to ongelea sana story things to do with matters health that really relate with the guys who are sort of getting into the adulthood age, guys who are being exposed to the new world. Especially these are guys who are from high school, guys in campus, just guys at home. So I'm sure you've had an experience as much as you're dealing with maybe the young ones, but at the same time, being in the medical field, I'm sure you are exposed to these guys who are affected by the things that they happen to ignore. I would like to say they happen to ignore. What are some of the things that you think the youths, or maybe the adults, the new adults, fresh from high school?
I can say it's sexual health. Sexual health comes in terms of there's family planning for the young girls. There's use of condoms, contraceptives. There's HIV. There's sexually transmitted infections, urinary tract infections. So I can say that there's a gap in that area. Mainly that people, the youths that coming from high school, especially those who have cleared high school and interacting with the community, or let's say those who are joining the tertiary level, you can say the universities and colleges.
Yes.
There's a gap in HIV awareness and sexually transmitted infection and family planning.
Okay.
Yeah.
So if we would talk about this, especially first of all, let's start with the family planning. How safe or how good is family planning to young girls or maybe teenage girls?
Very safe. There are documents to support that. I would say family planning should be part of an adult or a teenager woman, and also the boys. Let's say girls and boys, because we want to avoid unwanted pregnancies. We want to avoid sexually transmitted infections.
Mhm.
We want to avoid young mothers. We want to avoid young fathers who they don't know what's going on. There are
Mhm,
people who
mhm.
just met, have sex, and boom, there's a baby on the way.
Mhm.
They don't know who to talk to. They don't know where to go to. Like they literally have no knowledge about that. So we should, I can say we should sensitize them on that. If someone knew what is going on, what's going to happen if he or she have sex,
Mhm.
then it would be better and would reduce that number a lot.
Okay,
Yes.
okay.
There's also HIV.
Mhm.
You see, the three go hand in hand.
Yeah,
It's
yeah,
either
yeah.
You get pregnant, you get infected with the STIs, or you get HIV.
Uh-huh.
Yes.
Okay.
There's always an outcome. There's always a consequences of
Mhm.
having unprotected sex.
So, what is where does the gap come in? Some who is not informing the other about what they're supposed to do, what to avoid? Your gap inatokea wapi? This sexual education, where is the gap coming in? Nani anafaa kuinform the other?
I think it should be an approach from three people. Yeah,
Mhm.
that should be from high school.
Mhm.
It should be a topic in high school. Let's say from 4,
Mhm.
and then the parents,
Mhm.
and then the university.
So about the parents,
Yes.
mi issue yangu inakuja hapo. I think from our African setting, I feel like our parents are not comfortable enough to talk about sexual things, getting pregnant, nini. Even these days, I'm surprised that when girls wanagundua wameanza kunyesha, they feel like there's something wrong they've done.
Yeah, on which it is absolutely normal.
Yeah.
So me, I would urge parents, like we currently have modern parents, like
Mhm.
most of our parents are learned.
Mhm.
If not some, then I would really encourage our parents to like take that topic seriously, especially the sexual health.
Mhm.
They should be close to our girls, our sisters. They should close to our boys
Mhm.
and teach them. It's not bad to talk about menstruation. It's not bad to talk about using condoms. It's not bad to talk about sex, STIs, and HIV. Because when you are told and let me say, as in when you're told with your parents, it will sink more. Yeah.
Yeah.
You listen and you will not mess up. You see.
Mhm.
Yeah. So I really urge your parents to improve on that.
So besides the parents,
Besides the parents, the
who else can
schools-
come in?
The schools.
Uh-huh.
Yeah, there should be a subject in.
Uh,
There should be a subject in sexual health,
uh-huh.
especially with those clearing from 4
Uh-huh.
and the new freshers in colleges.
Yeah. Yeah, so
But most colleges have adopted, like the medical schools. I think there's a first week where they talk about HIV and sexual health,
mhm.
but most they don't emphasize on
Mhm.
things that really matter. Yeah.
Okay. So you mentioned something about HIV.
Yes.
How bad is the ignorance about HIV?
It's bad, like really bad. Yes. Yes. It's bad, like really bad.
Uh-huh.
See, there's a lot of misconceptions. People say if you have HIV once, you may not get it with someone unprotected sex.
Talking to the mic.
Okay. Or some people say that if you have unprotected sex once, you might not get it even if the person has. Others say if someone is taking their meds, you cannot get it.
Uh-huh.
Others say if you drink, I don't know what. There are a lot of stories out there, you see? Yeah.
I can
And
imagine.
people tend to assume. Kuna hii story inaitwa kupimwa na macho.
Yeah.
This guy is healthy. This guy play rugby. Looks good. This guy is a bouncer. This girl works in a hotel. You see?
She's
Yeah.
decent.
So anasema, this guy cannot have HIV. So you,
Uh,
or you just have sex for the first time with condom. The next day, mshazoeana.
yeah.
Today you guys have raw sex. I'm not tested. You don't know. You don't know the sexual partners of your friend.
Mhm.
You see.
Mhm.
The boy might be having 3 sexual partners, and those 3 still have their 2 or 1. So you see, it's a chain.
Yeah. It's a
Same
chain.
with a girl. You see?
Yeah.
So
Mhm.
it becomes a problem, and people just I don't know. You throw hands in the hair and say, tushajuana.
Tushajuana.
So mara ya kwanza condom, mara ya pili condom, then the next si tunajuana.
That's terrible.
Yeah.
That's really terrible. I can imagine.
Yeah.
Mm.
And then that's where now STIs come in, unwanted pregnancies come in,
Mhm.
because that someone might not have knowledge of family planning, or they are not even on family planning. You just get to just have sex and they go. They don't talk the next day. They don't talk after 3 days. So
Mhm.
what happens?
Uh-huh.
Yeah.
So what is the first risk of exposure? Is it pregnancy? Is it HIV? Is it STIs? Which one comes first among all this?
All of them. If
We
you
can't
have
prioritize.
unprotected sex with someone you don't know,
Uh-huh.
you can have the three of them.
You can get
Actually,
all of them.
Most people are diagnosed with HIV
Mm.
when they are having chronic, let's say chronic recurrent
Illnesses.
Yes, yes.
Uh-huh.
So you can say if someone has been having a persistent discharge, been on medication, they're
Uh-huh.
treating UTI, but it is an STI, it's gonorrhea, it's syphilis.
Uh-huh.
That's when they test for HIV.
Uh-huh.
And I would advise, like most hospitals do, when you come for a UTI, as in you have symptoms of UTI, you should get tested for HIV.
Okay. So another thing is, na hii niko sure nayo,
Yes.
watu wanaogopa kupima ukimwi.
Sana. You'd rather test to know things
Najua
rather than assuming.
kuna watu walipimaga once kitambo, alafu anasema mi
Mimi
najijua.
niko sawa, najijua, but
Mi najijua.
they've been exposed all along. See?
So I feel like, cause me guys, my peers wenye tunaongea nao sana, I can tell most of them are not into ati ai umeenda kupima, why? I know I'm okay. Asina haja ya kupima.
Najua niko sawa.
Najua niko sawa.
I've only had one girlfriend. What about the girlfriend? Kama amekuwa na partners wengine.
Mhm.
Yeah. So it's a big issue. It's a huge topic. It really needs a lot of sensitization, education, media. Venye tunaiskuma tu hapa online. I think
Yeah.
hivyo tu.
Yeah,
People should get
yeah.
to know these things.
Yeah.
Such that when someone tell you, I'm okay, you can test tomorrow, we can have sex. You see, you can still test. You can still have an HIV test today and it's negative.
You see,
What if you were exposed like a week or 2 weeks before, or the viral load is suppressed? Yeah,
let's say I'm exposed to someone who has HIV today
and you don't know.
and I don't know.
Yes,
How long will it take
it
for the
depends.
symptoms
It
to show?
depends. For people, it's different.
Uh-huh.
Others 3 months, others 2 years,
Yeah.
depending with cell replication.
Uh,
You cannot say someone is HIV negative by just testing. As in, you cannot rule out HIV by testing once and having unprotected.
okay.
That's why we
okay.
have, you can test like today and then after 3 months you repeat.
Uh-huh.
If the person is clean, that you can say
Uh-huh.
you're safe to go.
Okay.
So the mistake people do is we can test and then we can tongana
Ro. Hivo.
bazangama. That's it.
Tricky.
It's tricks.
Mm. So between so tuwezi eka bias ya majamaa na madem, nani yako at more risk of exposure kwa sababu tuseme tu kama imekushika. Juwezi sema ati hii kitu inashikanga madem rahisi ama hii kitu inashikanga majamaa rahisi. There's a debate on that, right?
There's a debate on that.
Yeah, that is why I really wanted to point it out.
Let's say everyone is at risk, because if you tell people that the female are at more risk of getting because they have a big orifice, you cannot substantiate that. So let's say everyone is at risk. So long as you're having unprotected sex, you are at risk.
Yeah.
Yes. So tell people to avoid multiple sexual partners, having unprotected sex. Just use protection. Yes.
Mi nataka kuna kitu ya maana sana umesema hapo. Telling people to avoid multiple sexual partners.
Yes.
How can you convince people in this era to avoid multiple sexual partners?
You can tell them, like you lay like the effects of HIV and how having multiple partners can contribute or can increase your chances.
Uh-huh.
And then they'll have to decide for themselves. But if you insist on that, the bright ones will take them. So they'll get to know what's going on, what's up.
So we can say the most important thing is being informed about
being informed and being sensitized and repeating.
Yeah. So there's a rumor that there's a shortage of condoms in Kenya. Is it true?
Yeah, it's true.
Is that bad?
If you've been having, you see, most people are like the youths have been. You see, there's that program in the university where people there's condom bins in every hostel.
Yeah.
Yeah. So the government issued it was USAID.
Yeah, USA.
The sure condom. The red one.
Yeah.
Yeah. So it's for now there's a shortage of that, but you can still buy a condom. There are those that's good for 30, 50 bob, 100. Yeah.
So it's just good being safe, on the safe side.
It's good being safe. Yeah. Just use a condom.
Okay. So as much as we already spoke about it, but I just got another question. We talked about family planning.
Yes.
So kuna hii story ati watu wanasemaga ati family planning can affect your hormonal balance, it can affect your normal menses, it can affect this is especially kwa females.
For females.
Yeah,
that's true. Every family planning has side effects apart from the non-hormonal ones.
like the condoms
The
and
non-hormonal, like condom, IUCD. So the others like Implanon, progesterone only pill, daily pills, emergency pill, they have effects like every other drug. You see. Yeah. So, but the benefits outweighs the risk. You see.
So okay, we about the same. Unaonaga dem amesema mi niko na nini ya family planning. So me I can go out there, mi naweza fanya mambo yangu. Do you think after madem wamepata the injection ya family planning ama their own family planning, they now become ignorant of other sexual risks?
Yes, they become ignorant because I think wanasemanga hata wase wa kampo hata let's say the young couple, the young people who are trying out there, the hustlers, sisi sasa. Wanasemanga wanaogopa ball kuliko kila kitu. You see? Someone rather not get pregnant than get HIV. You see, like, hey, bora means patable. Hata staki kufikiria, unaona? You see, and most people that have that family planning work on hiyo sasa, they tend to have unprotected sex because they know, hey, on a family planning. They don't care about STIs, they don't care about HIV. That's where the problem comes in. Yeah.
So unajua, I think these days hatuna knowledge so much about guys who have other easy sexual diseases zingine kama tuseme gonorrhea, syphilis, nini, chlamydia, hizo zote. Kuna zingine nasikiaga ni pimples kwa mdomo, mtu anasema ni homa. Anasema ati niko na homa kumbe si homa. So how bad is it?
Go down,
yeah, guys can go down there. Just go down on me.
Kila mtu. It's a problem, yes.
So how do these other sexual diseases come in? Yani ile ignorance watu wako nayo ya hizo zingine.
So when we say sexual transmitted infection, STIs, that's when you have sexual contacts. And it can be oral, it can be through penetration, it can be anal.
Yes.
See, these days kuna mambo mingi.
Kuna mambo mingi.
So when you say sexual transmitted infection, for women, I can say number one is vaginitis, the most caused by fungal, and then bacterial, E. coli. Ile unaweza jiwipe vibaya upate, or you can get kanjo stuff. Watu wanasemanga nilitumia chombaya. Usually watu wanapenda kublame hiyo, maybe nilitumia chombaya, nilishare choo, nilienda choo ingine, unaona,
lienda kwa jirani.
People have to wanna blame, kumbe alienda kwa jirani, see. So when someone comes with the most common symptoms, dem anasikianga kwanza ni itchiness, inaanzanga na itchiness, na hiyo dysuria, we call it painful micturition. Akikojoa anasikia kauchungu na mwasho, and then low abdominal pain, there's some pain in the lower abdomen, and then discharge. So someone comes with those symptoms, clinically you can say just it is vaginal discharge. How is the discharge, color, smell, when did it start, you see, things like that. So you'll have to narrow down, is it vaginitis, inflammation of the vagina, is it cervicitis, is it gonorrhea, vaginal candidiasis, ziko mingi, so you can name them. And then same with guys, with dudes, someone comes with painful urination, itchiness and discharge. That's mostly for men.
So ukianza tu kujikuna inafaa ujiulize
ama ulcers on the penile shaft.
Shaft ni hapo mbele
tuko shaft tu prepuce hapo. Kwa nini? Ndio glans penis. So glans penis. Kwa mzidigide anasema akona ka pimple, nimepaka mafuta lakini bado ni chungu haishi, imekaa ishi. Then mwingine anasema niko na discharge. So you can tell them to milk the dick, you can see the discharge too. Okay. Sometimes it sticks on the boxers. Unapata imekwamia boxer ka glue kidogo, then boxer ina stain. They will usually notice hiyo discharge.
So how can you self-diagnose yourself? Ujiambie ufike point unyoseme
any
I need
discomfort.
check up.
So when you have any painful micturition, then frequent, unakojoa mara mingi,
Mhm,
then ukikojoa pia kuna uchungu na inawasha.
Unawasha.
And then kuna discharge, unusual discharge nye si mkojo, si maji. Men we are not supposed to have discharge, you see.
Ni mkojo tu.
So you see those 3 symptoms, kimbia mbio sana, enda waambie daktari. Na usiende chemist ati unamwambia nipe azithromycin, nipe amoxicillin, nipe doxycycline. Pana, don't self diagnose, just go to the clinic. Tell the physician your story na anakusort. Usually they respond to medication at a start dose ile ya once, 3 days tops, 5 days, depends with what you have.
So it's bad to self-diagnose. Useme
Yes,
niko
don't
na
self-diagnose.
niko na
Go to the
syphilis.
hospital. Ati niko na
Ama niko
gonorrhea,
na
nidunge
gonorrhea.
ile sindano. Ama ati nidunge ile sindano ya UTI. Sindano ya UTI ni gani? You don't know. Yes, we don't know what you have.
Okay.
It is good, just go and show the doctor. Hata the doctor might squeeze your penile tuangalie. Let me see. Angalia hiyo ulcer nye unalenga. Maybe ni herpes. You see? Yeah.
So mtu ukiji self-diagnose, kuna watu wako biashara atakudunga tu ama
So
atakupea.
kuna chemist au wako job. Ambia nataka nasikia kuwashwa na kama niko na UTI. Anakwambia kuna sindano moja hapa pa. Nakupiga sindano ama nakuzia dawa. Bora yeye akuuzie.
Bora amekuzia.
They will not follow up on you. They will not tell you about abstaining from sex. They will not tell you about treating your partner. They will not tell you about recurrence and what to do. They'll treat your symptoms and off you go. But when you go to the clinic, the physician atakuuliza uko na girlfriend, how many partners do you have? When did you have sex? You see, how do you feel? They will get more clinical history and they'll have a good picture of what they're treating.
Okay.
They also have a gram stain and a urinalysis. You see?
Yeah.
How do we know that it's bacterial? How do we know that it's fungal?
Yes.
How do you know that it's protozoal, ama ni viral? You see?
Yeah.
So it is always good to go to the hospital. Wewe utaenda kwa chemist wakupea antibiotics na kama ni wakupea azithromycin na ni fungal.
Yeah.
So naona. So you'll end up having the same issue ukifikiria umetibiwa, you are worsening the situation.
Okay, about one last question about HIV. HIV comes in with very many different symptoms. Nasikiaga mtu anaanza na homa, anaanza na kukumwa na kichwa, kukohoa, nini, different things. So I would want you to tell us more about not treating symptoms but treating a disease.
Like for HIV it's human immunodeficiency virus, you see?
Yeah.
So when you have HIV, we cannot say that most people that are treated at stage 2 kuendelea huko, there are those that comes with what we call it opportunistic infections.
Okay.
Mtu anakuja na anapata TB, oral candidiasis, frequent diarrhea, frequent UTIs because the immunity is low. Yeah, that's when they are diagnosed with HIV, when wakati wamepata hiyo sasa opportunistic infections. Ndo sasa hizo symptoms zinakaa, but hali symptoms ni kama hii ya kawaida.
Okay.
In large lymph nodes ni hizi stuff zinakunga kwa zile shingo, mkono, mguu. Yeah. So hizo ndo zinakunga ya kwanza. Night sweats, weight loss, and then sasa hizo nye nishasema hizo frequent urination, frequent as in infections.
Okay. That's nice. At least we've had some good sexual education about the same. So parting shot. Wewe unaweza ambia nini mtu anachotana kwa club?
Ile ni
kuchipo.
Also there are things I'll talk about hapo next. So naweza sema if you chipo in a club, yeah, you bring yourself problems. It's not bad, yes, of course it's part of sexual life. Ni kama uko lonely pia unaona. Na kama hapo ndo unaona mambo yako iko sawa. But always use a condom. Go for regular HIV checkups. Use a condom. Use family planning and go for regular HIV checkups. That's it.
Okay.
Because if you chotana kwa club and then you use protection, there's no problem.
Okay. Safety first.
Yeah. Safety first. Can do your thing but safety first. Also on HIV sasa siku hizi kuna stuff zinaitwa PEP, kuna PrEP. And then kuna watu wanaitwa high risk category. Sex workers, policemen, also wana interact na mass people, unaona? There's what we call PrEP. If you anticipate in having unprotected sexual contacts with people that you don't know their HIV status, you can use PrEP. PrEP is pre-exposure prophylaxis. You take it 72 hours before the time you anticipate to have unprotected sex. There's also there's a one that is called an OD pills, once daily pill
Okay.
before you go for the act.
Okay.
So we also unaona kama siku hizi sex workers wako very educated on matters HIV and STI.
Okay.
Those guys are on prep. You will not infect them if unaona.
Wako informed.
As much as they are on prep, they still use condom.
Yeah,
so
yeah.
they protect themselves.
Uh-huh.
Yeah. So I can say you can have a look at that. It's a broad topic. We can talk about it the next time. And then there's also PEP. Let's say yesterday Tito hapo umeenda ukapatana na mwanadada pale amekufurahisha. Kesho mambo ikago down. Say you don't know their status.
Yeah.
Ameamka asubuhi ameenda, wewe umebaki hapo tu unaangalia kitanda, mlango imeenda. Una namba yake ama kama kuna namba yake haingii, alikupea Telcom. Radu. So the first thing you go have an STI prophylaxis. Utapewa dawa za kuzuia STI, utapimwa HIV at the same time, na pia utapewa ya kuzuia UTI, as in STI UTI, and then utapewa your PEP. You take them for 28 days. It will effects zake ni normal. Watu wanaogopanga wanasema ati ukikula utanona. No, it's just normal like any other medication. Maybe stomach upset hivyo. Hallucination hakuna. And then squeezing ni just one tablet. You take it once, the same time, like if you do it at 9, tomorrow at 9 p.m. So there is PEP. So just don't get exposed. Alafu unaanza kushika kichwa sasa, what will I do? Nitafanya nini? Go to the hospital. Sema mimi have had a common, see, sometimes on condom bust.
Condom bust.
Hey, I had a condom bust with someone I don't know the
status.
I was raped, as in things happen.
Yeah.
So you get checked, unapewa hizo prophylaxis, mambo yako inakuwa sawa.
What's your take on USAID on HIV?
That's a broad topic. Ni controversial. But all I can say, it will have a major impact. It already has. Most of the clinics are closed. Almost half in the country. The staff were laid off. So I would urge the government to really chip in on that, because it is a major thing. That there will be blowbacks, there will be consequences, you see.
Nilikuwa naona kama CS wa health alikuwa nasema by 2030 we will have 60,000 more infections of HIV.
If the trend goes like that. You see kama sahi kuna panic. Those people who are on meds wanaenda kwa several clinics. Mtu anakuja hapa anaenda another town because they want to stock up the meds. Yeah. So no, it will be a problem. Like the government should really intervene on that.
Okay.
Yeah.
Thank you so much Bana for making time and coming over.
Anytime.
Pazi, nashukuru sana. Next time maybe pia when you come over we can get into some other things, get into more diverse things.
Yeah.
Pazi.
Thank you for having me.
Karibu sana.
Thank you.
Pazi.